We are starting to make a difference.
I just want this all over. I want to be able to see my kids again.
We're in a riskier position than a lot of people.
We need to start changing the plan.
Although there is light at the end of the tunnel, we are far from out of this.
Good evening and welcome to Our Shot, Vaccinating BC. This is a CBC British Columbia town hall, and tonight we're answering everything you want to know about the COVID-19 vaccine and this province's plan to get that shot in your arm. I'm Anita Bath.
And I'm Stephen Quinn, and this hour is your chance to ask your questions to our panel of expert guests. Our phone lines are open now across the province. The number is 1-800-825-5950. In Metro Vancouver, the number is 604-669-3733.
You can also ask questions on the CBC Vancouver Facebook and YouTube pages and on Twitter at CBC News BC. We'll get to as many of your concerns as we can, and our panel of experts is ready to respond.
And to tell you about our panel, joining us from Victoria, we have Provincial Health Officer Dr. Bonnie Henry. BC's Minister of Health, Adrian Dix, is with us as well. Dr. Shannon McDonald is the Acting Chief Medical Health Officer with the First Nations Health Authority. Dr. Victoria Lee is the CEO of the Fraser Health Authority, and Professor Mahesh Nagarajan is the Senior Associate Dean for Research at the UBC Sauder School of Business and an expert in supply and distribution.
Good evening to all of you, and thank you for joining us tonight. Now, before we begin, we'd like to recognize that we are on the ancestral and unceded territories of the Squamish, Musqueam, and Tsleil-Waututh people. We are, of course, sitting 8 feet apart to adhere to COVID-19 safety protocols. All right, let's get right to it with a question to Dr. Bonnie Henry. We have to start with news announced late this afternoon that people 85 and up will now be able to start booking their vaccine appointments tomorrow rather than the original plan of next Monday. Dr. Henry, do you anticipate this will continue to happen as we move through the age cohorts? Can we expect to be vaccinated sooner than the current plan suggests?
I'm hopeful that we will. You know, there's always a bit of startup growing pains, but once we get the clinics up and running, and many of them have started already, get people booked in, get that sense of, okay, we can get through this, we're going to make it work. I'm really confident that we'll be able to speed things up.
Okay, thanks, Dr. Henry.
And we are going to get to your questions in just a moment, but first, let's take a look at how this mass vaccination rollout is going to work.
Hi, I'm Angela Starrett with CBC News, and I'm going to take you inside the largest vaccine effort in BC's history. Monica Stasiak preps her station as today's first vaccine recipient comes through the door.
Hi.
Hello.
I'm Monica. I'm one of the nurses here. You can have a seat.
Gary Lazar is a Vancouver psychiatrist, face-to-face with patients daily.
Do you have any severe allergies?
Only to wasp stings.
It's going to be a little poke.
And just like that, it's done.
It is a time where we're collectively facing both tragedy and miracle.
And BC health authorities need a shot of optimism moving forward. They say 400,000 British Columbians will be immunized from March to April.
Okay.
Ratsarinti Radananchai is a registered nurse at the Vancouver General Hospital.
And of course, after any vaccination, we just ask for you to stay about 15 minutes just in the aftercare room.
Sure. I just like everyone to continue doing social distancing and wearing PPE, wash their hands, and follow the rules.
Health authorities are now setting up 180 immunization clinics in school gymnasiums, arenas, convention centers, and community halls. Mass clinics for the general population are scheduled to start on April 6th. Well, as you can imagine, vaccinating all of BC is a huge undertaking. My question for Dr. Victoria Lee, what are the biggest challenges you're experiencing in your health authority as we ramp up for mass vaccination?
And so, Dr. Lee, that question for you, can you highlight the biggest challenges for the Fraser Health region right now?
Thank you so much. And certainly, as mentioned, it's a historic effort and the largest immunization strategy. So I would say there are three areas that we pay a lot of attention to. First is people, and you saw some of the people that are doing the immunizations, but it requires a huge amount of workforce, because not just the immunizers, but also those that are going to control traffic, those that are going to be wayfinding and supporting seniors, as well as people that are in there for security, supervision, cold chain volunteers, etc., and clerks. So it's a huge number of people that we need to recruit, and that is well underway. And then one of the areas that you highlighted is place. So lots of space requirements and lots of positive partnership from communities and businesses that have willingly come forward to offer their spaces. So getting that infrastructure ready with COVID safety plans in place is another area. And the third area I would say is systems. So information systems, digitally being ready. We want to ensure that the reports that Dr. Henry and Minister Dix provide are accurate. So that has a lot of information needs, and everybody with the computers infrastructure, and they need to talk to each other. So that's another big area that we look at.
All right, Dr. Lee, thank you very much.
Okay, question now for Professor Nagarajan. You researched the best ways to set up vaccination clinics. What are the challenges when it comes to staffing these facilities, and are there enough staff?
Thank you. I don't know if there's enough staff. That's not a question I can answer, but I can tell you that it is a pretty big undertaking. As some of the people in the panel have already mentioned, this is historic. So we are looking at vaccinating 4 million people in about 90 days. Assuming just one shot. And that's a lot of shots per day. It's 45,000 shots in a day, approximately. So if you think about, there's been a mention of over 100 vaccination sites. You need immunizers. You need people who are going to be greeting the people to come in, taking records, and then you need people to monitor them when they're waiting for those 15 minutes after they get a shot. And that's a very big undertaking. And one of the things that we want to sort of keep in mind is we can plan and staff assuming there is going to be not that much uncertainty in the system. But as we already know, there is going to be uncertainty. There's going to be unexpected things that happen. There may be delays in supply. People might fall sick. While they're vaccinating, some staff may not come in time. They may not be able to show up for work. In which case, we want to have enough staff and flexibility so that we still keep on schedule. It is a very big challenge.
Okay, thank you very much, Professor.
And we will go to the phones, and our first question of the evening comes from Leanne in Vancouver. And Leanne, you have a question for Dr. Henry.
Oh, hi, Dr. Henry. About hearing people who have been vaccinated and now have COVID. I'm wondering, is it severe COVID, or how safe will I be when I get the shot? Will I still get COVID at the grocery store or from seeing other people?
Dr. Henry.
Yeah, very good question. And I know that's one of the things we've been watching very carefully to see how well the vaccines actually protect in the real world. And yes, we have had a few people, particularly in 2 long-term care homes, but the illness that people get tends to be very mild, even in older people. So we know that it works really well at preventing most people from getting the infection at all. But if you do get it, it's much milder, and the studies showed that nobody ended up in hospital and nobody died. So those are really important things to remember as well. It does do a really good job at protecting us from all of those severe things.
In the care home outbreaks, Dr. Henry, is it a concern to you that we had more than 80% of residents in those homes vaccinated, and yet we still saw new COVID-19 cases?
Yeah, and we're watching those very carefully, and the one home, like I said, the illness, even in the older people that were affected, was very mild and remains very mild, and we're not seeing it spread like we did even a few months ago, where as soon as it was introduced into a care home, it seemed to spread just like wildfire. So those are good news things, but we are, of course, watching it very carefully.
Dr. Henry, thank you. Leanne, thank you for your question. Well, tomorrow marks 1 year since the World Health Organization declared the COVID-19 a pandemic. And the disease has killed 1,394 people in British Columbia. And for a year, the pandemic has disrupted all of our lives.
But there is an end in sight, if you can believe it. It's possible every eligible adult in BC could get their first vaccine by July 1st. Here's how. Currently, around 6% of all British Columbians eligible for the vaccine have gotten one dose, but BC is guaranteed to get around 1 million more Pfizer and Moderna doses over the next 6 weeks. And when you look at the amount of supply the companies have promised for Canada in May and June, it's enough to get the rest of the province in a vaccine clinic by Canada Day. So with all of that in mind, Professor Nagarajan, when it comes to vaccine supply, is there any factor or factors that could derail the plan?
Certainly. We've already seen that early on in the process, what we were guaranteed to get, we did not get. There seems to be a lot more certainty now in the vaccine supply, which is excellent news. We also have new vaccines coming, and there is the AstraZeneca vaccine and the Johnson & Johnson vaccine. But as you know, just this morning or yesterday, Prime Minister Trudeau said that the Johnson & Johnson vaccine is not going to show up on time. So there's a lot of things that can go wrong. So based on what people have already said, there are 3 important things to sort of consider. One is the information system, the booking, the phone call system, how people actually make appointments. The second thing is the actual vaccination centers, staffing them, having a smooth, nice process that can get people vaccinated. And third is the supply uncertainty. The vaccination plans will go very nicely and smoothly, and we can handle the first 2. The third one is something we cannot really control. If there is supply uncertainty, that is going to throw a wrench in the best laid plans. And so to buffer that in some ways, what we do is we have extra capacity in terms of our vaccination centers. What I'm trying to say is that if we don't get the vaccines in time and we suddenly get a windfall of large amounts of vaccines, we want our vaccination centers to be able to ramp up and vaccinate people as per the schedule of July 01.
Makes sense. So we really need to be able to change as we go based on the amount of vaccine that's coming in.
Exactly.
Thank you.
And Minister Dix, for a year now, people in BC have been told to just hang on a little bit longer. Can you explain why British Columbians should have faith in this timeline, given the uncertainty in vaccine supply and the logistics involved in vaccinating nearly 5 million people?
Well, this pandemic has tested us in ways that I think none of us would have expected. And I think British Columbians have done very well. They've generally followed public health orders, I think, as a rule, and public health guidance. And the result of that has been an overall outcome compared to other jurisdictions. It's been good in BC, and I think everybody in the audience can take pride in that. An enormous effort is going into the delivery of these vaccines. And the Professor is right, these things can change. We saw that happen in January and February, and we adapted. We focused in on those that most needed to be vaccinated then, and in long-term care, that's had a profound and positive effect. And I think as long as the vaccine arrives, we're going to be able to deliver it to people. And I remind people that in this pandemic, this year, 1.5 million people were immunized against influenza. Our teams in public health, Dr. McDonald, Dr. Henry, the teams that they lead are just remarkable. This is what they do. This is what they're dedicated to. And we're going to do everything we can to deliver the vaccine in as the best possible way to everyone in BC. And you can see 180 clinics for phase 2, more coming for phase 3. We're getting ready to do just that.
Minister Dix, thank you.
And we have a question from social media coming in right now. Is the vaccine, this is from Pearl on Facebook, is the vaccine something that we have to take once in a lifetime? Besides the booster, how long does it last? And can we take another vaccine like Moderna if our first shot came from Pfizer? So that's sort of 2 questions there. And this is for Dr. McDonald.
Thanks. I appreciate the question very much. And to be honest, it's a question that we're asking as well. We don't know for sure how long the immunity is going to last because the vaccine hasn't been around all that long. So that period of time between the first vaccines and where we are now, we've actually seen people's response grow over time, so it's become more effective. And that's allowed us to increase that interval between a first dose and a second dose and allow us to free up some of the vaccines that are coming. It is still unknown whether or not some of the variants that are in circulation are still going to be impacted by this vaccine, or whether or not viruses, as viruses always do, the virus will change a little bit, and in future we may have to have a booster to look at some of the variants that can come forward. Dr. Henry, at a meeting we were at this week, talked about this being science in action, and it's very much science in action. We are learning more and more every day, both about the virus and about the vaccine, and following those details and the research very closely to make sure that we're providing the best to the people in BC.
Science in action, things changing every day. Thank you, Dr. McDonald.
And one of the key questions that has come up is how to protect our province's Indigenous people. And let's go now to a recorded question from an Indigenous health official on the North Coast.
My name is Kirsten Milton. I'm the health director with the Newhalk Nation, and I live in Bellacoola. During the process of vaccinations, we have identified a serious gap in being able to deliver vaccines to some of our most vulnerable members. These are people without stable housing. Many are couch surfing and getting by as best as they can, and many are suffering from addictions. My question is, how does the province's vaccine rollout plan address these vulnerable people living in rural and remote areas?
And that question to you, Dr. McDonald, how does the plan address people who don't live in urban areas and may not have a home of their own or who suffer from addictions?
It is absolutely a challenging question, and thanks, Kristen, for bringing it. The all-of-community approach that we have taken forward to serve First Nations people, especially in remote and isolated communities, and have been able to work with our provincial partners to see that that will be continued in other small and rural and remote communities. There shouldn't be a challenge to reaching some of those people in terms of having vaccine that's available. Having it there in a timely way has been a challenge. We've really struggled to make sure that we have what we need to have in place, but that's changing as the vaccine supply increases. And we have partnered with First Nations communities to help us identify individuals who may be challenged to come to wherever a clinic is occurring. We've had partners in Vancouver Coastal Health Authority, for example, who have gone out to urban settings like shelters, like drop-in centers, to vaccinate the most vulnerable in those communities. We've seen high rates of COVID and serious illness among those populations. So we hope that we can work with you in community. It's very, very important to have a strong partnership to do that the best way possible. And we will continue to circle back to communities to find those who may have been reluctant the first time around, may have not been available the first time around, so that everybody who wants a vaccine can have one.
All right. Thank you, Dr. McDonald.
Dr. McDonald, they're talking about people living in rural areas. Dr. Lee, what about people who do live in urban centers and are experiencing homelessness and addiction? We saw nurses administering COVID vaccines on the streets of the downtown east side. In Fraser Health, how are you going to get to people where they are essentially?
Yeah, thank you for that question. Of course, street entrenched people are a vulnerable population group, so we want to ensure that they're protected from COVID-19. And one of the strategies that we have used is working very closely with our community organizations, as well as our First Nations and Métis organizations as well. Unfortunately, First Nations, Indigenous people are overrepresented in that population. So what we have done is to ensure that we're providing a culturally safe and inclusive type of a clinic outreach type of an environment. So we've gone out to shelters where there's Aboriginal liaison that's available. We have food that's available, it's not shared food, individually wrapped food, and those types of things, to be welcoming the individuals and having lots of information that's provided in different languages, as well as information that's available that's culturally appropriate in terms of vaccine safety. So all of those endeavors have helped to outreach into that street entrenched and very vulnerable population.
Are you worried, though, that some people may fall through the cracks?
Yeah, I think that is and always a big worry, especially in our region where we have seen vaccine hesitancy significantly in the past, whether it's measles or pertussis or otherwise. So I think in terms of vaccine safety, what we have seen is community leaders, Indigenous leaders, different cultural leaders speaking up about the importance of vaccine and how it's a life-saving endeavor that we're engaging in right now has been critical to increased uptake in our First Nations communities, as well as with our urban Indigenous population, and also in our street outreach. And as Dr. McDonald mentioned, we'll be going out not just once or twice, but multiple times to ensure that there's ample availability and ability and accessibility for people.
Thank you, Dr. Lee.
Let's go back to the phones, and we have a question from Ursa in Victoria, and Ursa would like to direct that to Dr. Dix. Go ahead, Ursa. Or Adrian Dix, rather. He's not a doctor, he's a minister.
Hello, can you hear me?
We can, thank you.
Lovely. So this question is pertaining, my son will be 18 soon, and he's thinking of going to work in Alberta for summertime. If his time for vaccinating, getting his shot comes up when he actually is supposed to be in Alberta, have you heard if we can possibly get a shot outside of our home province, or should he stay in BC to get his shot and then go to Alberta?
Minister Dix.
I think arrangements can be made to have it in either place. Many people move between our provinces, and there'll be people living in Alberta now who are going to move to BC, and they're going to be covered on our age-based approach. We want to immunize everyone in BC, and that's an important thing for everyone to understand. Every time we immunize someone, every time someone's vaccinated, it makes all of us safer. So we want to get to everybody, and in the case of your son, he'll be able to make arrangements either to get it done at the appropriate moment in Alberta, or alternatively in BC.
Thank you, Minister.
So
and thank you for
can go either way. And I think all the doctors were glad that you clarified it was Minister Dix.
I'm sure they were. Thank you, Minister. And thank you, Ursa, for the question.
Okay, we do have another question from the phones. Let's hear from Pete in Vancouver, and his question is directed toward Dr. Bonnie Henry. Pete?
Hi. A study in Nature showed that the Pfizer and the Moderna vaccine were effective against the UK variant, but they found that the Moderna's vaccine was 12 times less effective against the South African variant. Pfizer's was 10.3 times less. Is there a vaccine that's effective currently against the South African variant? How long will it take to get a booster on those two? And also, given that there was another study of 11,000 people in Israel showing that adults and kids with ADHD had up to 50% higher rates of COVID if they were not treated with ADHD meds, and they had lower rates than controls if treated. When are you going to give some guidance on for the parents of ADD kids and ADD adults, especially when there was a separate sub-study showing that 5 to 20-year-olds who were diagnosed with COVID, almost a third of them had ADHD, 28.14%, and only 8 to 10% of kids, and 5% of adults have ADHD. So what are you going to do to protect us?
Dr. Bonnie Henry?
So two very different questions there. So let me address the ADHD one first. There are many things that we are learning about this virus and who it affects and how it affects. And I'm not familiar with that specific study, but we do have a team here that looks at all of the clinical evidence and helps us understand what are the best treatments for which people. So that is where we get our advice about who should be treated with which medications and and what medications are associated with better outcomes or not. So I am not aware of that one offhand, but we'll certainly look at it. And we have to be a little bit careful because some of these studies are what we call ecological studies, and they may not actually be individually a clinical study that allows you to tell whether that is the medication that's making a difference or something else. So they all need to be looked at, and we've set up a team that helps us do that. In terms of the vaccines and the variants, that's also a question that we've been watching very carefully. And there are several different studies that have been done. What we can say is that in the clinical trials for some of the vaccines, if they were done in South Africa, where the South African variant was quite prevalent, was very high in the cases, it didn't seem to have as much effectiveness or efficacy in preventing disease, but it still had very good, very strong protection against hospitalization and deaths, which is incredibly important. The study that you reference was one looking at immune markers, looking at antibodies. So that doesn't always tell us the whole story because there's many different parts of our immune system. But having said that, we know that both Moderna and the Pfizer-BioNTech teams are looking at whether they need to tweak the messenger RNA that's in the vaccine to help better cover the mutation that has made a bit of a difference. So all of these vaccines are designed to develop antibodies to the spike protein. That's the spiky bit on the outside of the virus. And the mutations cause differences, slight differences in that protein. That means that the antibodies may not bind quite as well. So the neat thing about this cool new technology, the messenger RNA technology, is that it can be adjusted and tweaked quite relatively easily. So we may find that there'll be a booster dose that is slightly different. It may be what we have two different types of RNA, so it covers the one that we're in, the spike protein that we're seeing now, plus one of the variants, or it may just be adjusted a little bit so that the antibodies we produce are more likely to bind to the common strains that are circulating. So these are all really exciting things that we will be learning in the science in action over the coming months.
Thank you, Dr. Henry. You are watching our CBC Vancouver Town Hall on Vaccinating BC. You can call in now with your questions for our experts across the province. The number to call is 1-800-825-5950. In Metro Vancouver, the number is 604-669-3733. Now, many people living with disabilities are more vulnerable to COVID-19 than others. So I want to go now to a recorded question from a young man who lives with Down syndrome.
My name is Aaron Robbins Waddingham. I live in Burnaby. Disabled people need a vaccine right now. Older people with Down syndrome can get very sick from COVID-19. Why doesn't a government listen to disabled people and give a vaccine? Give us a vaccine right now. Do you care about disabled people or not?
Minister Dix, a pretty pointed question there. How do you respond to Aaron?
Hey, thanks, Aaron, for your question. And the answer is that we do very much. People who live in congregate living, so people who are living in group homes, are getting immunized right now in phase 2. And priority is being given to people with a variety of health conditions, and Dr. Henry can speak to those in detail, including people with developmental disabilities, people in your circumstances, early in phase 3. So we are giving priority with people with disabilities, and we've heard lots of advocates like Aaron for people with disabilities, because we have a whole community of self-advocates that makes their voice heard. The evidence shows that it makes sense to do that, and that's why we're doing it right now for people in congregate settings and in group homes, and we'll be doing it early in phase 3 for others in that community.
Okay, thank you, Dr. Dix. Dr. Dix, that's what we're calling you down tonight.
Dr. Dix. His mother always wanted him to be a doctor.
Thank you, Minister Dix.
Thanks, Anita. Question from social media, this one from Stephen on YouTube. And Stephen is asking, what kind of documentation can one expect to get when one gets vaccinated? Will that paperwork be considered a vaccine passport? Will they become necessary for travel? Dr. Lee, put that question to you.
Thanks for that question. And I think that's probably stemming from some of the other countries or settings where there were vaccine passports and such. So right now, in terms of immunizations, it's being recorded. As I mentioned, that's a critical component of how we're implementing immunizations on site. So when somebody gets immunized, all of their information is entered into a provincial system so we can consistently track everyone that's getting immunized, as well as being able to tell that we're focusing our efforts in priority populations and able to track adverse events, etc. You will get a note that you have been immunized, and you have an option of taking a paper copy of that. Otherwise, we do have your records at the provincial level.
Dr. Lee, thank you. Right now, we are in phase 2 of the vaccination plan, and the focus is on seniors, and there are a lot of them here in BC. Here's a look at some of the current challenges in protecting this vulnerable population.
I'm Justin McElroy in Vancouver's Chinatown neighborhood. There are approximately 230,000 British Columbians over the age of 80. It's the highest percent in Western Canada, and they have a lot of questions that aren't necessarily getting answered by the government.
什么时候能接种？谁通知他们？
I'm one of the fortunate one, but like a lot of seniors who doesn't speak English or like with a little bit older than me, they won't able to access of this information and won't able to have help to ask their specialist and ask their family doctor, and they don't even know where to get the vaccine at all.
There are plenty of organizations that want to help with the vaccination drive, but they're often on the sidelines.
This morning it was a 91-year-old woman who has diabetes and can't really walk or get about, and she's very concerned, and as well for her husband who's in a wheelchair. So it's a little bit hard for us in a way answering the phone because we don't have much more information.
The question for health authorities is whether seniors that have mobility or language barriers are getting the supports they need.
And so, Dr. Lee, that question to you, the big issue, it is a big issue in the Fraser Health Authority, of course. How do you plan to reach seniors and communities who don't speak English and get the message out about the vaccine?
Yeah, two very important questions. So I'll tackle the first question around diverse populations, because it's a very important area for Fraser Health. Actually, 90% of refugees and 40% of newcomers in BC settle in our region. So it's a very diverse region, one of the most diverse regions in Canada, actually. So reaching diverse population, especially the seniors population, is very important to us. So there's a lot of partnerships with our community organizations that I've mentioned earlier. We have been reaching out into specific settings where seniors might also be more familiar with. There's also language translated into multiple languages on our website. We have online virtual ability when people call in to translate into over 200 languages. When people come into our site, we also have that virtual translation ability in over 200 languages. So I think there's multiple areas of work that we are engaged in terms of communication engagement, as well as actual booking and immunization process. In terms of the mobility question, that's an important question as well. So as you might be aware, home support clients who are long-term home support clients who might be homebound, as it's been communicated through the province, are prioritized in this phase. And we've been reaching out to understand whether they're unable to travel, then we go into their homes to immunize. For general population seniors, there are two ways that we're looking at this. When they're homebound, we can either have transportation services, and some of the communities and municipalities have stepped up to help and support in that area, as well as our own arrangement with transportation. Sometimes families have been able to also transport them, and we do have 5 drive-through immunization sites that we have heard very positive feedback on, and people are able to use that. Otherwise, we can also provide homebound individuals with outreach into their homes.
A very brief follow-up, if I can. Will those seniors be able to arrange those home visits when they make the call to schedule their
call into our system, there's an algorithm of asking questions of mobility, and if they're not mobile, we will either arrange transportation through our networks, or we will arrange homebound home outreach service.
Dr. Lee, thank you.
Professor Nagarajan, Dr. Lee seems quite optimistic here, but there were already so many issues with getting through on the phone lines in the first few days of the vaccine sign-up. So how likely is it in your eyes that some seniors might actually fall through the cracks?
It's quite possible, and I think Dr. Lee alluded to this even before, that she is concerned about a different population where some people are going to fall through the cracks. I mean, this is very challenging. I mean, I know that the phone lines did not work out. You know, it was a private provider who owned up and said that they could have done a lot better. But I think that's been said before, this is not an easy thing to do. When you open up the phone lines, the expectation, I think, is that people who would call in, who are supposed to be scheduled this month, would be the ones to call in. But from the data, we know that a lot of people who were not supposed to be vaccinated in this phase still wanted to call in to see if they could somehow get a shot. And then, of course, there are people who are not going to be able to access the phone lines because of languages. When we go to an online appointment system, it is not just the seniors. We are again going to have problems where some people are not going to be able to access. I think Dr. Lee is right. So that's where you leverage your public outreach networks, where these people would be recognized in some other way. And then they would either be brought to a vaccination center or a clinic, or the vaccines would go to them. And there's been some good work in other parts of the world where similar populations exist, and we have some nice lessons to actually learn. So I'm optimistic that most people who needed to be covered would be covered in this next couple of phases.
Okay, thank you, Professor.
And we'll go back to the phones, and we have a question from Bobby in Grand Forks. And Bobby, you've got a question for Dr. McDonald.
Yes, I do. My concern is regarding allergies. I am one of those people in the world that is allergic to all seafood, basically anything from the ocean. I'm concerned with some of the reviews that I have read with regards to what is in the vaccine and whether or not I am going to be in a position where I'm going to have an anaphylactic shock from the vaccine.
Dr. McDonald.
I can understand if you've had an experience, Bobby, with anaphylaxis, how that might be extremely concerning for you. My husband's also a seafood allergy guy. But we've read through quite carefully all of the ingredients in both the Pfizer and Moderna vaccine. I'll admit I haven't read through them as much in the two newer vaccines yet. But for the most part, the protein, the messenger RNA piece is the most active piece. There are stabilizers, so chemicals like salts to stabilize the product, and some lipids or oil product to make it, to protect the messenger RNA. So the ingredients as a whole are fairly low on the list of holding allergens. That doesn't mean you won't get an allergic reaction. We have seen some allergic reactions among the 30,000 people that we have vaccinated in First Nations communities. There has only been one allergic reaction that required somebody to go to hospital. They were only there for a few hours and they recovered quite well. So it's not at all, but what I can tell you is that as part of their training, everybody that is providing vaccine is highly capable of responding to an allergic reaction to make sure that you're protected as much as possible in that circumstance.
Dr. McDonald, thank you. And Bobby, thank you for that question.
And now we have a question from Facebook. Irene asks, and I think this is something a lot of us want to know, I know I do. If I'm vaccinated and another friend or family member is vaccinated, can we visit together without masks and indoors? For Dr. Henry, sorry, this question is for Dr. Henry.
Sure, okay. And that is the question. The short answer is eventually yes. Right now, we still have quite high levels of transmission in the community, and we know that vaccination doesn't necessarily, or at least we're learning, it may not prevent you from getting a very mild or asymptomatic illness that you may transfer to somebody else. But eventually we are going to get there. And the one thing that we know is that this takes some time for your immune system to develop that protection. So in the first 2 weeks, you still want to be very careful, and you want to make sure that you're using all your protective layers. But after that period of time, if you're both immunized and you're in your bubble, then yes, you don't need to wear masks. But we still need to take all of these precautions in public. And for the near future, that's going to be really important. But we will get to a place where there's enough people immunized, particularly people who are most at risk. And we're starting with the people who are most at risk, our seniors and elders. And once they're immunized and protected, then we'll be able to spend more time with them and know that we're not putting them at risk. And we've seen just this week, the U.S. Centers for Disease Control and Prevention put out some guidelines, and I think those are similar to what we are looking at. They have a much higher level right now of immunization in the population, but we're going to get there, and we're talking across the country about making sure we have consistent guidelines here in Canada as well. So in the next few months, we'll be there very soon.
And just quickly here, Dr. Henry, when you talk about, yes, we can hang out inside without masks, are we talking after 1 dose or 2 doses?
Yeah, so that's what another science in action. We used to think that you had to wait 2 weeks after the second dose. But the real life data has showed us that this vaccines that we have right now are very effective of protecting you after the first dose. So the guidelines will be able to reflect that. And most importantly, right now, we've immunized so many people, high 90% of people in long-term care homes. So that means that once we get to that few weeks where everybody's immune system has been activated enough, we'll be able to increase visits and have real meaningful visits with our loved one in long-term care. And I see that coming before the end of March.
Many looking forward to that, I'm sure. Thank you. Now, with an array of vaccines available in BC, just how many people here plan to get one? A new survey by the Angus Reid Institute shows 2/3 of respondents would take the COVID-19 vaccine as soon as possible. 17% prefer to wait and see, and 10% of British Columbians say they just won't get it. So let's get into vaccine hesitancy now. Here's a family doctor who seems to be getting a lot of questions about it.
Hi, I'm Dr. Madhu Jawanda, and I'm a family physician in Surrey. I get asked a lot of questions from my patients about the vaccine. One question is it safe for a pregnant woman to take the vaccine? Or can I take the vaccine if I'm thinking about getting pregnant? Does the vaccine affect my fertility? And I get this asked by men and women. Another common question I get asked is, will this vaccine affect my DNA? And another common question is, will this vaccine, or does the vaccine contain any fetal product? Does it contain any animal products such as pork or beef?
A lot of questions there for you, Dr. Henry, but I think you're used to that. Let's go through them as briefly as we can. And if you can, please answer with yes or no answers. First off, are the vaccines safe for pregnant women?
You know, this is something that pregnant women who were known to be pregnant were excluded from the clinical trials. So there was a caution that came out when they were first came out. But we now know they've been used in pregnant women, and we know that pregnant women are more likely to have more severe illness with COVID. So it is doing a risk-benefit analysis, but the guidance that we have in Canada, looking at the data that we've seen, is the answer is yes. They're safe and they're effective, and it's best to be protected.
Okay, continuing on with some myth busting. Do the vaccines affect fertility for men or women?
Not that we know of. And when we look at sort of biologic plausibility, is this a possibility with the type of vaccines? And so we're talking mostly about these messenger RNA vaccines. It doesn't appear likely that it's going to affect fertility or DNA, for that matter. This is an RNA. It's a little piece of RNA that gets inserted into the cells to replicate that the antibodies or the spike protein so that your body's immune system can recognize it, and then it fades away and it goes out of your system. So no, we don't think any of those are our concern.
Okay, and finally, do any of the vaccines contain fetal products or animal products like pork or beef?
No, those aren't on the ingredients for any of the ones that we have approved here for use in Canada, that are in Canada right now. That is, there was some concerns about a cell line that was developed in the early 80s that some vaccines were developed from, but these ones are different, and they're new vaccines, and they don't contain any of those products.
All right, thank you, Dr. Henry.
And back to the phones, and we've got a call from Judy in Vancouver, and Judy has a question for Dr. Lee. Go ahead, Judy.
Hi. Given that the vaccination program is being described as research in action, there's an absence of any long-term data regarding the future efficacy or harms for the approved vaccines. How then can people provide truly informed consent to receive a vaccine?
It's a good question to you, Dr. Lee.
Thank you. And that's an excellent question. And I think both Dr. Henry and Dr. McDonald mentioned science in action. While it is science in action, it has gone through a very rigorous national, international processes for approval. And the findings are absolutely clear that it is a safe vaccine. And that has been reviewed not only through clinical studies, but also real life effectiveness in terms of millions of doses that have been administered across the world. So I think in terms of consent and informed consent, you would be basing that on known process of rigor as well as lots of evidence that's being generated globally.
Vaccine was created, developed, and delivered in under a year. Is it fair to have concerns about whether it does have long-term effects, or do you just dismiss those out of hand?
I don't think you can dismiss long-term impacts altogether, because as it was mentioned earlier, it is still all of the data is being gathered. But I think so far, in terms of knowing the science behind it, knowing the way the vaccines work and the specific vaccines and how they work, there's a lot of confidence in terms of the long-term impacts. But of course, that will also be monitored closely.
Dr. Lee, thank you. Well, the vaccine rollout is well underway in some Indigenous communities, and let's take a look at how Indigenous people on reserve are welcoming the vaccine.
I'm Angela Starrett, and I'm here on one of 3 Katzie First Nations to find out how the COVID-19 vaccine rollout is going in this community. More than 31,000 Indigenous people have been vaccinated. They are among the hardest hit by the virus. In the northern region in the winter, positive cases doubled that of the rest of the population and tripled in the island region. Some communities are far from hospitals, and further, because of racism, some are too afraid to go into them. Chief of the Katzie First Nation, who lost her sister to COVID-19, says vaccinating will save their lives.
Having First Nations communities across Canada being prioritized for the first vaccinations is critical in how we live as a people.
79-year-old Lorraine Schwartz was the first to be vaccinated here.
Good. Great.
And Katzie councillor Rick Bailey was equally relieved.
It's finally real. We're getting it. It's just not overwhelming, but happy that one day soon I'll be able to have my family over for dinner.
As exciting as today is for the Katzie, many I've spoken to are worried about those who are not here. Their question for Dr. Bonnie Henry: why are their community members and relatives living off reserve, off their traditional territory, not being prioritized?
And so, Dr. Henry, that question to you: can you explain why Indigenous people who live off reserve are not getting the vaccine as quickly as those who do live on reserve?
You know, I think the short answer is we absolutely have been prioritizing Indigenous peoples, whether they be First Nations, Inuit or Métis here in British Columbia because we recognize the disproportional impact that COVID-19 has had. But we have had, as you know, limited supply of vaccines. So we have had to do it in a process, in a way, and we started with our partners in the First Nations Health Authority by identifying those nations that are more remote and isolated and going for all nations in British Columbia. And as Dr. McDonald mentioned earlier, we've gone to what we call an all-of-community, a whole-of-community approach, which means all of the adults, both living on and off reserve, who are connected to that community. And it has meant, in some cases, there has been some challenges in making sure we have enough vaccine to do that, and in finding people who may be connected to communities. And that process is ongoing. And it's ongoing as part of our partnership. I will say as well, we have a large Indigenous peoples who don't live or are connected with communities and are living in urban areas and other areas. And we've prioritized them again by recognizing the issues that they face and being able to sign up for the clinics and come into our clinics at an age that's 15 years younger than non-Indigenous peoples in British Columbia. And we've been working with our partners to make sure that that is a safe experience for Indigenous peoples here in British Columbia.
Dr. Henry, thank you.
All right, an important question for you, Dr. McDonald. We're hearing complaints from non-Indigenous people about First Nations getting vaccinated earlier. Indigenous people say that's led to racism. So is the province doing enough to explain why it's so important that Indigenous people are vaccinated quickly?
I think there's two things in your question that I'd like to address. As Dr. Henry mentioned, we know that First Nations people are at more significant risk for lots of different reasons. There are higher rates of chronic diseases that may affect their ability to fight off the infection. We have had significant numbers of illness and even death in populations much younger than in the general population. Multi-generational houses, for example, where if you go in and vaccinate just the elder and the other people in the family are not vaccinated, there continues to be a risk in the household. So we have been able, through evidence, through data, been able to show the increased risk and therefore worked with our partners and the province to have First Nations prioritized, not just here in BC, but right across the country. The other thing I want to address is the racism question. The vaccine is not causing racism. The disease is not causing racism, but the anxiety and the fear in people's lives and in their relationships are coming to the fore in a way that they may not otherwise. And so we need to address those issues straight on. We need to talk about those feelings. We've had communities, side-by-side communities, where the First Nations have received their vaccine before the non-Indigenous community. And there's been a perception that First Nations are the cause of any outbreak in community, where we've proven that that is not the case, that even though the First Nation may have been very transparent about the number of cases they have on reserve, that neighboring community has not been equally transparent. And when we were able to talk to leadership about that, it was very evident that it was a battle that everybody was facing. And we've seen really positive examples when Indigenous and non-Indigenous communities work together in the face of a cluster, as was done in Alert Bay, the Namgis community in Alert Bay, where the response to the COVID cluster was collective, and the utilization of vaccine in that community was collective. And it was a positive experience for everyone.
Okay, thank you, Dr. McDonald. We want to go to a question now from the phones. Diane in Surrey has a question for Minister Dix. Diane?
I, as a 77-year-old mother and grandmother, have very serious concerns about the health challenges of my 40-year-old son, who has type 1 diabetes. He's a single parent and the sole breadwinner and main caregiver of his family. May I give him my spot in the COVID-19 prevention vaccination lineup and then be moved into his later age spot? Yes or no, and why or why not, please? And how might this switch be arranged?
Interesting question. Minister Dix?
The answer is no. You can't. I know the experience. As you know, I'm 56 and I have type 1 diabetes. And the decisions that have been taken is that the highest level of vulnerability is by age. And so we're doing this by age and other factors, and including some severe illnesses that have put people up the list. But the good news is, because of some of the changes we've made and because of the new supply, we should be able to get to your son sooner. But you can't trade off. We hope that you get your vaccine when the 75 to 79-year-old group is open shortly. It won't help your son to not be vaccinated. In fact, it will help him if you are vaccinated. I can say that with respect to my own mother, who's in her 80s. I want her to get vaccinated. I couldn't imagine trading places with her. We are obviously concerned with the impact of COVID-19 on everyone. There is an impact on people like me and people like your son who have type 1 diabetes. But we think the most efficient and the best way and the highest risk is based on age and some other factors, for example, indigeneity, and we are operating on that basis.
Okay, thank you, Minister Dix. We have another question for you. We know a lot of people are wondering where kids fit into the plan. Here's a recorded question from a father and son on Vancouver Island.
Hello, my name is Eli Tonkin.
And I am David, Eli's dad. And we have a question about vaccines for kids.
Right now, my friends and I cannot play sports against other teams.
And we understand that kids are not part of the Phase 4 vaccine rollouts. We do understand that in the States, clinical trials are underway for kids, and it's my belief that kids are at lower risk. So here's the question. If kids are at lower risk and proper safety protocols are in place, then why can't kids play against other teams? And if they are at risk, then why are they not part of the Phase 4 clinical vaccine rollout?
And we are going to put this question to Dr. Henry, in fact. Dr. Henry, there you hear David and Eli yearning for a normal life. Why aren't kids included in Phase 4, and when can we expect they will be vaccinated? And can the rest of us hold out any realistic hope of a normal summer?
The last answer, absolutely. I think we can. The reason behind not including young people at this point is that the clinical trials were designed to find a vaccine to protect those people who were most at risk of having severe illness and dying from COVID, and that's older people. So the trials were not done in younger people. If it was a few years ago, we had an influenza pandemic and the vaccines were trialed very early on in young people because they were being most affected. But as mentioned, some of the vaccine manufacturers are doing trials now. The Moderna and Pfizer, the Pfizer actually I think it is right now, is looking at children as young as 12. And then there are other studies that are starting to look at children even younger than that. But the good news is that most children don't have severe illness, which is great. And that once we get everybody who's likely to have severe illness protected, it protects all of us as well. And yes, I do think by the time we get to the summer, we're going to be able to have a lot more normalcy and hopefully even before that for young people with some safety precautions in place. And we do think that there might be vaccines available for children, but probably not until the end of this year or into 2022. And by that time, we'll know a lot more about how many doses we need, what's the best interval, do we need to have boosters every couple years or not. So a lot more to learn before we get there.
So no hugging grandma just yet?
But you know, that's the thing. When grandma's protected, then yeah, once she's gone through that period of time when to give her body a chance to develop the right antibodies, then we can go back to hugging again.
All right. Thank you, Dr. Henry.
Okay, and Minister Dix, can we go to you for just 30 seconds of closing thoughts here? We've got a lot of good questions tonight.
We've had a lot of great questions, and I just want to say to everybody, express my appreciation to everyone in BC for what they've done over the past year. People sometimes ask what was the hardest time in the pandemic so far, and I think it may be the weeks to come. There's lots of hope in this vaccination effort, and people are going to get safe and going to get safe over the next few months. But right now, today, we had more than 500 cases. So I'm asking everybody to stay safe and to restrain especially their social contacts this month, especially this month of March, so we can continue to limit transmission while we're starting to vaccinate our most vulnerable people.
That's all the time we have this evening. We hope we've helped answer your questions about the COVID-19 vaccine. Our thanks to you, our audience, for sharing so many great questions tonight.
And thank you to our guests for their time and expertise, Dr. Bonnie Henry, Minister Adrian Dix, Dr. Shannon McDonald, Dr. Victoria Lee, and Professor Mahesh Nagarajan.
If you still have questions about the vaccine rollout plan in BC, you can head to gov.bc.ca/COVID-19. This has been Our Shot, Vaccinating BC. Thank you so much for joining us tonight. Good night.
Good night.